Namaskar. I am Dr. Madhusudan Singh Solanki, Senior Consultant Psychiatrist. If you feel low sometimes, are you depressed? Or if you feel hopeless and frustrated in certain situations, are you depressed? Or if you feel broken and shattered after a failed love affair for some time, are you depressed? Or if you are an introvert and you don't like going out much, are you depressed? The answer is no. Let's find out why. In layman terms, people call all these situations as they were being depressed. Yes, we all feel low in such situations, but is it clinical depression? Clinical depression, which is also known as major depressive disorder, is very different from the personal setbacks happening in our day-to-day life. Major depression is a clinical disorder and is much more than the normal sadness we all feel sometimes. Sadness or feeling low is just another color of the emotions of life we all experience in our day-to-day life. How will you appreciate happiness if you have never been sad? Sadness is just another normal emotion, as happiness or anger are. It's normal to feel sad if the situation is sad, and that's definitely not depression. Clinical depression, or in scientific terms we can say major depressive disorder, is a clinical disorder which is a combination of certain symptoms lasting for a certain duration with a certain severity, and it may happen to a person when everything is seemingly going fine in life. In other words, it may happen without any trigger or reason. The symptoms are persistent low mood most of the day, nearly every day. Markedly reduced interest or pleasure in almost all activities, most of the day, nearly every day. Thoughts of hopelessness, helplessness, worthlessness, or excessive and inappropriate guilt nearly every day. Psychomotor retardation means a person becomes very slow in activities, or psychomotor agitation means a person becomes restless, impatient, and impulsive. Increase or decrease in sleep nearly every day. Significant loss of weight or gain of weight. Fatigue or loss of energy nearly every day. Difficulty focusing, concentrating, or deciding, or forgetfulness nearly every day. Recurrent thoughts of self-harm, suicide, or a plan to commit suicide, or an act of self-harm. So if all these symptoms are there for more than 15 days, then there are high chances that you are suffering from major depressive disorder and you should seek professional help. Coming to the scenarios I discussed in the beginning of this video. So if you feel sad most of the time, so if you feel hopeless and frustrated most of the time, so if you feel broken and shattered even after weeks of a breakup, so if you are an introvert but you feel sad most of the time, and you have other symptoms of depression as well, and all this is affecting your life in a negative way, then yes, you may have clinical depression and you should seek professional help. Reason for depression is a combination of genetic predisposition, neurochemical changes in brain, including many neurotransmitters like serotonin, dopamine, hormonal dysregulation, immune system dysregulation, and many other subtle changes in different areas of brain with cognitive and psychological reasons as well. Situations and adverse life events make a person vulnerable for depression or even can trigger an episode. If your kidneys can malfunction and result in problems with urine formation, because that's the function of your kidneys. If your liver can malfunction and result in problems with digestion, because that's the function of your liver, what will happen if your brain malfunctions? Obviously, it affects your thinking and mood because these are the functions of your brain. If your heart and kidneys can malfunction, so can your brain. Remember, your brain does not come with a lifetime warranty. Almost 20% of people suffering from depression end up killing themselves by suicide, and depression plays a role in more than 50% of suicide attempts. We can save a lot of lives if only people consider depression as a disorder and seek help. Depression exists and it's real. No matter you are having tons of money or none, no matter you are a celebrity or a common man, rich or poor, successful or failure, man or woman, depression spares no one. It doesn't discriminate. It's like a dark cloud of sadness which engulfs you and leaves you completely crippled and crushed to the extent that at times suicide appears to be the only way out. When a person is clinically depressed, all your lifestyle and good life gyan, like do some exercise, pray, do some meditation, meet your friends, go out, nothing works as the person's brain is not helping the person to think or act beyond depression. Imagine someone who has just suffered a stroke or paralysis and lying on the bed. Will you expect that person to just get up and walk and run as if nothing has happened? Severe depression cripples a person similarly. Only difference is that it is invisible and you cannot see that. So next time you see someone depressed, know that it's more painful and disabling than many physical disorders, and try to understand and empathize, and don't dismiss it as nothing. So remember, depression is not the routine day-to-day personal setbacks or lack of energy or motivation. It is a clinical disorder which requires treatment through medication, psychotherapy, or a combination of both. So if you notice yourself or anybody around you having these symptoms, talk about it, seek help. Thank you so much.